Today, I'll be showing you the use of body wear during angioplasty. In cases of calcified plaque, sometimes we feel the difficulties in passing balloon and stent, and in these cases, the use of second wear as a body technique may be helpful. Since in this case, these patients presented with acute IWMI, as you can see, the significant blockage proximal to the total cutoff. That is a very calcified plaque. So we thought that there will be a problems in stenting. Therefore, as we thought the initial wear was not going, then we took the help of a second wear in a different branch, and we could exchange the wear. Then we tried to put the stent at earliest, but it was again problem due to the proximal plaque. We use the second wear. We upgrade the wear to a typically whisper, and though it is very difficult in this acute scenario, then it took balloons to predilate the bed. Bed preparation is very important in these scenarios, and then you could pass the long stent, as you can see. And after that, the proximal portion was also stented after proper predilatation, and you can see the success of such a restoring flow in a huge RCA. So here lies the importance of this body wear and proper predilatation. Thank you very much for watching. Keep subscribing, keep watching.